So, to all the parents who are concerned about their child's speech, so the first thing that happens when a baby is born is their hearing. So, they start hearing noises, people's voices, and that is really the key because from there, the nerves which connects the brain from the hearing center start to align, start to develop, and that develops their listening and attention span. So, any child who is not talking must have an assessment of their hearing, and the hearing has different frequencies, and both ears are important. So, sometimes you might say, oh, the child is responding to noise, so hearing is fine, but important to make sure your child has got a hearing test done and which is within normal limits, which means the ears are doing their job well. The other thing is listening. So, hearing and listening are different. So, listening means that when you say something to someone, are they able to listen? Are they able to understand and follow, or they ignore you? So, sometimes listening can be a simple listening yes, no, well done, calling name, or listening could be a complicated listening go upstairs, open the cupboard, get me that. So listening has different stages. So listening is really important for understanding because if they're not listening, they might not understand. And understanding relates to the quality of speech. So once they develop understanding of the situation to say, look, I'm in a clinic, or I'm in the school, or I am at home, so or I'm at a visitor's place. So it's different situations have different expectation for them. So it's really important they have a bigger understanding like why the weather changed, why you can't go to school on a Sunday, what's happening. That usually naturally comes in neurotypical children, but in autism, these things, the understanding of these things can cause the understanding of these things can cause rigid behavior, can cause anxiety, can cause meltdown in children with autism. The next stage is the speech, which means making sound from the mouth. So sometimes children with autism might have difficulty in making sounds clearly, or they might speak in a monotonous way, which can be improved by working more on their listening, understanding, and speech together. So, autism is not just a speech problem, it is not that they can't talk, it's just the process before is not working very well. So, it's important that we understand that speech is not the goal in autism. The goal in autism is their listening, understanding, and good